Out of the coronavirus crisis, we had fewer new cases today in Massachusetts, but still more than 5,000, and we saw 37 more deaths. The positivity rate in the state is over 5%. Local doctors are sounding the alarm about the rise in COVID numbers. As WBZ's Kristina reports, they worry about the toll on healthcare workers and hospitals.
Doctors tell me this second surge is shaping up to be worse than the first, and they're worried about resources.
I think concerned is an understatement.
Nearly 1,400 people in Massachusetts are hospitalized with COVID-19. Not the most we've seen, but doctors like Mark Seidner from Mass General are worried about the rate at which those numbers are climbing.
I think we're at the point where we really need to start pleading with people to realize there is a breaking point here. We can't continue on like this. There's a maximum number of hospital beds. There's a maximum number of ICU beds.
You just want to open it up as much as you can like that.
The state is already preparing 2 field hospitals for COVID patients. In Worcester Friday, visiting nurses and doctors trained for the site at the DCU Center, set to open Sunday.
There's a lot of people who are scared, and I think that I have the ability to make them not feel as scared, and I'm just proud to have a chance to be able to help.
In the meantime, 97 cities and towns are now considered virus hotspots, including newly added Wilmington and Tewksbury.
It's just a level of relentlessness.
It's a trickle-down lack of resources that's making fighting this pandemic so hard, they say. Without money from Washington, the state can only do so much, putting these towns in a tough position.
And public health nurses throughout the entire Commonwealth are completely overwhelmed. And if they don't get help, if they don't see more support from the Commonwealth, it's just not going to get better for us.
Testing numbers, on the other hand, are way up, hovering around 100,000 people a day this week. And results are taking about 2 to 3 days. But the capacity to not only diagnose COVID, but contact trace and treat it, these experts say, is nowhere near ideal.
They've done the best with the limited resources they have available to them. But let's face it, in a perfect world, all of us would get tested every time we walked into a grocery store, every time we walked into work, every time you walk onto an airplane.
Dr. Seidner says right now it's all about wearing masks and staying home. So far, Governor Baker has said he does not want to shut down businesses. But Dr. Seidner says if these numbers continue to climb, that might be necessary. In Boston, Kristina, WBZ News.